Ever wonder what it's like the day after rhinoplasty? Hi, I'm board certified facial plastic surgeon, Dr. Delaney, and let's take a look. We first take out our non-adhesive packs. We do it one side at a time, and we suction out the nasal passage to get out any blood, mucus, to clear it out. Usually this feels pretty good. And then we'll clean the nostrils, the openings, using some hydrogen peroxide. This works really, really good for the dry blood. We then go to the other side, similarly take out the pack, suction out the nose, make sure it's nice and clean, and then clean this side as well with hydrogen peroxide. Works much better than soap and water. Then at home, and this is a demonstration, we have our patients lean back and do 10 squirts of nasal saline spray on each side of the nose. We usually recommend spitting it out because it doesn't taste very good, but if you swallow it like this patient did, not a problem at all, it just doesn't taste very good. So that'll help wash out the nose and then apply bacitracin ointment. I usually like using 2 Q-tips so you can kind of pass it back and forth to control how much ointment you have. You first want to apply ointment over the columnar incision, right at the base of the nose. Make sure you get the sides of the incision. And then you want to make sure you go up into the nostril, do kind of like a 360 to get those internal incisions. You gotta make sure you do it on both sides, enough to cover the incisions, but not so much that it ends up obstructing your breathing. Lastly, you want to go in a little bit further back. This is almost like the beginning of a COVID test, and you want to gently spin the Q-tip, paint a thin coat of ointment on the septum to help those absorbable sutures dissolve and also to prevent crusting. So we do this on both sides as well. And so this is done at home 3 times a day, saline drops and then bacitracin ointment. And then we're putting the mustache dressing back on. So typically for most patients, they use mustache dressings for 4 to 5 days after rhinoplasty if turbinates were removed, and 2 to 3 days if the turbinates weren't treated. There you have it. That's day 1 after rhinoplasty.